Good morning from Copenhagen, Denmark. We're here at the European Society of Cataract and Refractive Surgeons, and I'm pleased to have with us this morning Dr. Susana Marcos from Madrid, Spain. Thanks very much for being here today.
Thank you.
I understand that you are presenting today on a novel and very interesting topic, which is a way to predict or preview multifocal lens outcomes in cataract surgery. Can you explain a bit about this technology, please?
Yeah. The new system is called SimVis. It's a wearable device. It has different lenses programmed in, and the patient can see the world through these corrections, therefore making it easy to explain how the world looks like through a multifocal correction, because the patient actually see the world through that correction. It's programmable, and you can go through different types of corrections very quickly. So the patient can compare bifocal lens with trifocal lens, with an extended depth of focus lens. And also because it's binocular, you can also experience different corrections that may be different for one eye and the other eye, like monovision or modified monovision, where you implant different lenses, maybe monofocal correction in one eye and multifocal correction in the other eye, or two different multifocal corrections in either eye.
Well, that's so interesting that it's a binocular system, so you can mix and match, as you mentioned, in terms of choosing a different lens for one eye as compared to the other eye. Can you back us up for a moment and explain to us about the technology that allows this to work?
The technology is called temporal multiplexing. It works with an optoelectronic lens. It's an optotunable lens that can be programmed to represent different lens designs, different profiles of different lenses. The technology has actually allowed us to make the device very small. It's only 400 grams. So that's actually a step forward compared to other devices that we use in our lab, which is adaptive optics based. They tend to be bigger. And also because it's a see-through, it's a lens, you can actually use the lens to see the world through. You don't need a display inside the system.
Well, this seems like a great way to allow patients to try out the various different lens options that we have in cataract surgery, because sometimes this becomes an esoteric discussion with patients about what a multifocal lens implant would look like and what a monofocal or monovision situation would look like. And so I think it's very helpful in that regard. But one question I have, or one concern that I have is that let's say a patient's cataracts are at the level of approximately 20/70 or 20/50. Will they get a realistic viewpoint of how the lens implant will appear to them if their natural crystalline lens is already creating such impairment?
Yeah, of course, if you test the system with natural crystalline lenses or clear lenses, the world will look exactly as it will look through the lens. In a cataract patient, we have tried it. Of course, you cannot run a functional test and that being identical with the lens implanted. But what we found is that it's very good at ranking the lenses, so the patient can still compare the different designs and give a score to them and rank them according to their preferences. So to decide which lens implant is actually working. Mm-hmm. The reason why it's working nicely is because the technology allows to actually bypass the opacity of the eye, because it's a temporal and not a spatial. So the bifocal image or the simultaneous image can get through the clear parts of the lens.
I'm glad that you cleared that up for us. A couple other follow-up questions. How predictive do you think this is in clinical practice for your patients? Meaning that if a patient selects an extended depth of focus lens based on the SimVis, for example, and then after they've had their cataract removed and the lens implanted, do they find that the visual outcome is what they expected it to be?
Well, these are actually clinical research that they're actually undertaking at the moment, and there's a number of studies designed to answer specifically this question. What we have actually tested in the lab is that the through focus images and the through focus curves that you get with the SimVis match very nicely those that you get with the real lenses. So we have experimental evidence that we're representing the lenses correctly. We will have, and we're gathering at the moment, this clinical information to actually answer that.
That's a great point. And one final question on closing. Let's say a patient has had a monofocal lens implanted, or a toric lens implant, or any number of implants, and they are unhappy with that lens implant. Can this system then be used to try to predict how a lens exchange or a modification might affect that scenario?
Well, I mean, combining a multifocal correction with another multifocal correction simulated by the device is probably going to be difficult. We can use the other eye, it hasn't been implanted yet, or it can be done, depending on the lens design, we could try to bypass, like a refractive design could be probably easier.
Yes.
So depending on the lens design, we could also do that. But the idea with the system is that that stage doesn't need to be reached, because the patient will see how the worlds look like with the multifocal lens, and screen out those patients that will be unsatisfied after implantation of a multifocal lens.
Well, this is such an exciting technology, and I'm really glad you're able to share your thoughts and expertise with us today. Thank you.
Well, thank you very much.